Hypoglycemia in malnutrition. Definition is blood glucose level less than 3 millimoles per liter. The predisposing factors for hypoglycemia. We know that malnourished patients are predisposed to hypoglycemia because they have low glycogen stores, they have low fat, and so any infection will tip them into hypoglycemia. Any delays in feeding will tip them into hypoglycemia. And any hypothermia, because hypothermia is very linked to hypoglycemia. We like to say that hypothermia and hypoglycemia are in the same WhatsApp group. What that means that if the patient becomes hypothermic, then they will become hypoglycemic, because hypothermia will make the body to start to want to generate heat, and by wanting to generate heat, it will then consume the glucose that's there and lead to hypothermia. So hypothermia and hypoglycemia in the same WhatsApp group. So features of hypoglycemia in malnutrition, like we said, hypothermia and hypoglycemia, same WhatsApp group. So hypothermia will be seen, and hypothermia is defined as oral temperature or rectal temperature less than 35.5 degrees Celsius, or an axillary temperature less than 35 degrees. Then there can be convulsions. Okay, then the patient will be lethargic, and there will be eyelid retraction. So if the patient is sleeping, or if the patient is unconscious, their eyelids won't be, if they are sleeping, the eyelids won't touch. There will be eyelid retraction. And we must know that because of the affected mechanisms of response in malnutrition, the adaptive adaptation, the patients in malnutrition do not have the sweat response, so there will be no sweating. We expect sweating in hypoglycemia, but in these patients there will be no sweating. These patients won't sweat, and they won't turn pale. So that you need to know that in malnutrition, because of adaptive adaptation, they won't sweat. Then for a patient that is malnutrition and they are hypoglycemic, the general rule of thumb in managing of these patients is that we avoid intravenous fluids as much as possible. So if the patient is conscious, we give 50 ml of 10% dextrose. We can give it intravenous as a start dose once only, or we could give the 50 ml of IV sucrose a start dose once only. We can actually give this glucose or sucrose solution. The dose can be given orally, so you can choose to give it IV or orally, depending on the extent of the hypoglycemia. But as long as the patient is conscious, and you know that this patient maybe is not vomiting, if they are tolerating oral feeds, you can give it orally. But if maybe they are not able to tolerate oral feeds, you can give it intravenously. Then just after that, we then start F75 feeds at 3 ml per kg per feed, and we do that for every 30 minutes for 2 hours. Then after that, we switch to 11 ml per kg per feed every 2 hours. That is if the patient is responsive to treatment. We'll discuss what happens if the patient is not responding well to treatment. Then we have to correct hypothermia, because like we said, hypothermia can cause hypoglycemia. So we don't want the patient to go back into hypoglycemia. So we correct the hypothermia by warming up the patient, covering up the patient in blankets and clothing, covering the head, and putting the patient in a warm room. Then we have to treat any underlying infections. So IV antibiotics should be given as soon as possible to treat any underlying infection. Okay, so I'll just talk about how to prepare 10% sucrose. So 10% sucrose, this is different from 10% dextrose. 10% sucrose is made by mixing 1 rounded teaspoon of sugar with 3.5 tablespoons of sterile or boiled water. So that's the ratio. So 1 rounded teaspoon, that means the teaspoon is not leveled, it's rounded, it's full. Okay, and for preparing 10% dextrose, we know that in hospitals we normally have 50% dextrose, so, or you can buy that from a pharmacy, and then you dilute 50% dextrose. 1 part is to 4 parts of sterile water. That will give you 10% dextrose. Okay, the management of an unconscious patient. So in an unconscious patient, we need first to give IV fluids. Okay, So we give IV bolus of 4 to 6 ml per kg of 10% dextrose IV. This is intravenous fluid. Then we give okay, so this is IV intravenous. Then we give 50% of 10% glucose per ng tube thereafter. So after giving this 4 to 6 ml per kg 10% dextrose, we then give 50% of 10% glucose. Make sure that it's been ng tube, because this patient is unconscious, so they cannot take it orally by themselves. So we put an ng tube and we give the bolus. You can give it as glucose or you can give it as 10%. I think we have already explained how to make each of these fluid. Then immediately after, you give F75 starter feed per ng tube. Okay, so we expect the patient to become conscious after correcting the hypoglycemia, and if the patient becomes conscious, we continue with the management as per conscious patient. But if the patient remains unconscious, then we repair. Okay, so this is a table to just show how to manage hypoglycemia in malnutrition. So if the patient is conscious, we can give IV or oral 10% glucose 50 ml. Okay, 10% glucose or sucrose 50 ml. Then after that, we give orally F75 every 30 minutes for 2 hours, and then 11 ml per kg every 2 hours. If the patient is unconscious, we always start with IV fluids, 10% dextrose 4 to 6 ml per kg. Then we move to 50 ml of 10% dextrose per ng tube, and then from there we start F75 feeds. Okay, we want to monitor this patient, so we repeat glucometers, the finger prick, if the patient becomes hypothermic. So if we see the temperature goes, axillary temperature goes below 35, or the rectal temperature goes below 35.5, we have to repeat the glucometer. If the patient deteriorates or the level of consciousness drops, that is a sign of maybe worsening hypoglycemia. We have to check again the glucometer. But if the patient is well and responding well to treatment, then we have to repeat the glucometer check 2 hours from the initial glucometer. This is because we expect a rebound hypoglycemia about 2 hours from the initial one. Then if glucose falls to below 3 millimoles, let's say you have repeated the glucometer and you see that the glucometer is below 3 millimoles, we repeat 50 ml of 10% dextrose or sucrose, and then continue feeding every 30 minutes until stable. Thank you.